Good morning, guys. This is Dee. I'm going to make a little bit of a different video for you guys this morning. Although I do believe my outfit is smashing, it is going to be a nursing video. And it's going to be about coughs and colds with little ones. I know I did do a video before about respiratory distress with little guys, but I see it coming up again. And I'm hearing about a lot of little ones missing daycare, missing school, passing it back and forth to each other, to siblings, and these respiratory illnesses are quite severe, and they're not COVID, but they are quite severe, and they're causing kind of chaos in emergency rooms right now and in walk-in clinics and just everywhere. They're everywhere, and these little ones, they're lasting for days and days, and they're becoming more severe. And as I've mentioned in my last video, coughs and colds with little ones are so dangerous because when they can't breathe, they struggle to breathe, and it's called increased work of breathing. And again, I'll go over a few of those signs and symptoms like I did in the last video that you can watch for. They're not the be all and end all. If you're concerned about your child, you always go to the emerge no matter what, but I'll give you a few things to watch for as well. And those are good indicators that your child is struggling for air and that they need to get into an emerge immediately. So first off, I'm going to cover three things. First of all, I'm going to cover a way to prevent your child's cough and cold from becoming a respiratory issue, and to help relieve some of that some of that coughing and choking, and those choking and coughing spells that they get into where they're coughing and they can't stop. So the best way to treat that right now is to steam up your bathroom with just regular vapor. Close the shower curtain, so no one's getting burned by hot water. Steam it up for a good 5-10 minutes, and then sit in there for 5 minutes with your child, 3 to 5 minutes in the bathroom. Just close the toilet lid, sit on the toilet with your child on your lap, and breathe it in and let them breathe in that steam. And that's going to do two things. It's going to open the airway, but that wetness, that moistness is also going to thin out those secretions and keep them thin, so the children can cough it up and it doesn't block the airways so much. So that's a really good preventative measure that you can take to help prevent these coughing symptoms from becoming more severe. And it can also end a coughing spell. So in the middle of the night, you hear a child coughing, they can't sleep, they can't lay down, they can't do anything because they just can't stop coughing. That is your go-to. Steam up the bathroom, get them in there, and wait and see what happens. It's phenomenal. It works really well. The second thing is when they're sleeping, prop them up on some pillows, get them elevated when they're sleeping. Just like an older person that's having difficulty breathing, you want to elevate them. This is the same. This is the same with these little ones. You don't want the mucus hovering around in the airway. You want it to fall as low as possible so they can get as much air and their lungs can expand as much as possible. So get them sleeping, propped up on a couple of pillows, and that should help them get some sleep and help them get to sleep without the mucus interacting and causing too much difficulty and causing it to impair their ability to get a good night's sleep. So they're still going to be coughing, they're still going to be choking, you're still going to be wiping green mucus out of their nose and everything else under the sun, but the pillows will help a little bit. The third thing I did want to cover is the use of aero chambers. So I know a lot of kids are going to walk-in clinics at Emerge, and they're being given salbutamol. Those are the blue puffers, the emergency puffers. Those things are godly. If your child is very sick, has a respiratory illness, and you haven't gone to a doctor yet, go to a doctor and ask for a Ventolin puffer, because if they're wheezing, when they breathe, they're making that wheezy sound, that whistling, high-pitch, tight sound when they breathe. That blue Ventolin puffer is going to open their lungs right up. So that's a really important, that's a really good thing to ask for. Now, I'm not a doctor, I'm a nurse. A doctor might say no, but 99.9% of the time, the doctor is going to say yes, absolutely. They're going to give you a prescription for this Ventolin to take home. And they'll either give you or tell you to purchase this, an aero chamber, depending on the age of the child. I recommend these with all ages of children, and even for adults. They sell a type that doesn't have a mask. That's just the spacer thing. And I even recommend that for adults because it's hard to mechanically get it past your tongue and get the vapor, the mist from the spray into your lungs properly. And these things do the job, they get it done. So what I want to go over with this is because I've seen parents, I teach it in Emerge when I work there, I would teach parents how to use them. But I know you go home and you forget because it's like, it's mind-numbing. It's too much information at once. You're scared for your kid, and it's a lot of info. You get home, your kid's screaming and kicking, doesn't want the mask near their face. They want nothing to do with it. So I'm going to go over with you on how to do that. So first of all, ideally, your child's going to sit there nicely. You're going to press this up tight. So this part is nice up around their nose, their nasal aperture, right above their nose, and under their chin. It's going to rest right under their chin. I have a small face, so this child's aero chamber actually goes to me. And you're going to press hard. Press. Right? See that valve right there? That valve. You want to watch that valve when they breathe go in and out 5 times, and you'll see it go in and out 5 times, and that's how you know they got the medication. So how it works is you puff the medication into the puffer. It'll usually be 1 spray, sometimes 2 sprays the doctor will recommend. You're going to get the puffer on their face as fast as possible after that, and you're going to watch for 5 of these in and out. Count to 5 with them. If they're old enough to do that, that's great. If they're crying and screaming because they're an infant, that's great. The harder they cry, the harder they scream, the deeper they're breathing. So they're getting that right in as deep as possible. The third trick, unfortunately, some kids are a little older and they want nothing to do with this. You're going to put your child on your lap in front of you, facing away from you. You're going to wrap your legs around your kid. And you're going to wrap your arm around your kid and you're going to bear hug them. You're going to puff if you're on your own. If you have a husband or you have a partner or you have someone to help you, they can puff it while the mask is on their face. Puff it, okay? But if you're on your own, you're going to bear hug them with your arms and legs. You're going to puff the medicine into the puffer and you're going to hold it against their face so hard they can't move their face, okay? The other way you can do it is instead of holding their arms, you hold their jaw back like that. And push it on their face. Hold their jaw back so they can't turn their head and go like this, because that's what they're going to do. They're going to fight by turning their head. So either holding their head still or holding that still. But the key is in wrapping your legs around them so they can't get away from you. I know this sounds horrible, but this is the facts of life. This is what we got to do. And then with these aero chambers, parents will notice some relief after the first puffs, and they forget to go back because the gold is the going back. So that first set of puff opens the airway and the bronchial tubes, and it opens like the esophageal inflammation that's going on there, but it doesn't so much get to the lungs. It's just opening the path to the lungs. 5 minutes later, you're going to come back and you're going to do the same thing again. And that puff that's the one that's going to go into the lungs, because it's going to have passed all that area in the trachea. It's going to get all the way down because you already got rid of that inflammation because of the first puff, and it's going to get into the lungs and open the lungs up. And that, my friends, is what's going to relieve your child's really difficult time breathing and make their breathing a lot better, and it's going to last for quite a while. Read the instructions, read how frequently you can use it, but it's not a dangerous drug. The biggest side effect you're going to see is your child might be a little bit shaky after, because it does stimulate them a little bit, but honest to God, shakiness is no comparison to a child having to work hard to breathe, because they could only work hard for so long and then they can't work hard anymore. And this is why respiratory illnesses in children turn deadly, because children, it goes from a cough and cold to a respiratory emergency like that without noticing. And this is why you got to be on top of it. Be listening for those whistling sounds. There's other things to watch for, and this is what I was telling you. I was going to tip you off, but these aren't the be all and end all. If there's anything wrong with your child, you're seeing anything that's making you uncomfortable, you get into that emergency. You don't wait. Doesn't matter what anybody else says, your mom, your friend, your neighbor, anybody. Doesn't matter what anyone says, you go to emerge. So first thing you're looking for is changing color in the face around the mouth. Any change in color, doesn't matter, because children have all different skin tones. So any change around the mouth in color, into emerge. You'll see something here right in the trachea. You'll see them suck in. If you see that sucking in like that, that means they're working so hard to get air in that their increased work of breathing. They can only do that for so long before they get tired and they can't do that anymore, and that means the air isn't getting in anymore. So there's that. The other one is the use of accessory muscles. You'll see them raise their shoulders, trying to breathe. You see that going on? That's an emergency. That's not a walk-in clinic. That's an emergency department right away. What's the other one? Indrawing. Indrawing is if you lift their shirt up. I can't show you because I'm wearing a bodysuit. You lift their shirt up, you'll see the skin around their rib cage suck in when they take a breath. It'll suck in. It means they're sucking in so hard with all their muscles, all the use of all their accessory muscles other than their lungs to breathe, because their lungs can't do it on their own anymore. They need help. They need all the help they can get. And when you're in this situation, you're in a dangerous territory, because this is where it goes from a distressful situation where a child's still fighting to the point where they can't fight anymore, and you end up with child fatalities from respiratory problems. So if you see any of these things, this means go to the emergency department. If your child can't catch their breath and they're no longer talking in sentences, you see drooling going on, you see them not being able to catch a full breath, if you see blue lips, that's a 911. If their lips are looking grayish, bluish, dusky looking, that's a 911. If their breathing is starting to become very slow or way too quick, that's a 911. That's not an emergency department anymore. And again, anything else that you notice that makes you uncomfortable, if you think you need 911, you get there, because what they're going to do is bring a bigger version of this. It's a machine version, and put the mask on your child and give them that emergency Ventolin, that blue puffer, but in a high dose very quickly. And they're going to instantly reverse this tightness in the lungs and open up those lungs, flare them open so the child can get air immediately. And they're going to do that in the home before they even take the child to the hospital. So it could save your child's life. So always, always call 911 if you're unsure. If your child doesn't need to be going in an ambulance, they're not going to pack them up and take them in an ambulance anyway. They don't do that anymore. They're going to do a respiratory assessment. And if your child's in need of emergency help, they're going to get it. And if they're not, they'll just say, go to your family doctor or go into Emerge today or tomorrow or whatever. But they're going to provide a full assessment. And if your child is in danger, they're going to save your kid's life right there, because they have the equipment to do it, and they have the equipment to do it immediately and on the spot and right in your home without causing any problems. Then they'll take them into Emerge, and you'll get some longer term treatment, such as a prescription for a Ventolin and something like this to help you along the way. There's one caution I want to give you. There's products out there like eucalyptus products, these menthol products, these inhalers, body rubs, all kinds of stuff. I want you to be cautious when using these with your little ones, because there's a toxin in these, and if you get too much of it, it can be a toxic substance to your children. And regardless of how it's ingested, whether it's dermally through the skin or subdermally, or whether they're inhaling it through their nose, or if it's in a vaporizer, it's very popular to put them in vaporizers. A little bit is okay. In a big room, a vaporizer is okay. In a small space, not okay. You want this room to be ventilated. You want it to be a large enough room. You want it to be fresh air, so it's not concentrated, because in these mentholyptus and these menthol products, like I said, this toxin can be deadly to children. It causes seizures. It causes so many other negative side effects. You just use it. It's a great tool to have. You just use it very carefully in moderation and read the instructions on it and follow those instructions on the dosage. Don't just assume because it's a cream or a little inhaler you stick in your nose or something like that, that it's not going to put you at risk, or an inhaler that you put in your room that drops in your vaporizer, that it's mild. It's not going to put you at risk, because that's couldn't be the farthest thing from the truth. You are at risk. So as long as you follow the dosage guidelines on your product, then you'll be safe and you'll be able to use it, and it can actually help. It can be a good tool to use. Just be cautious with it and make sure you're following your dosing. And other than that, guys, that's all I wanted to discuss. I didn't want to drag it out, and I hope this video was helpful. If you guys have any questions, please come back and leave it in the comment box. And don't forget to give me a thumbs up if you like the video, and subscribe, okay? And I will see you guys soon. You take care and have a lovely morning.